Let's talk about rhinoplasty techniques. There are hundreds of different techniques, and you just have to customize the technique to suit the patient. I think analysis is super important in a rhinoplasty consultation. I will spend the first 10 to 15 minutes asking the patient what they don't like about their nose. If the patient cannot tell me what they don't like about their nose, then there is no operation, because there has to be a mutual understanding and agreement as to what is it that we're trying to change in the patient's nose. Now, rhinoplasty can be both functional and aesthetic, and a combination of both in general. So we have to decipher what the patient's breathing is like and how we can improve that if there is an issue with the breathing. And aesthetically, the patient has to be very clear in what they do not like about their nose, and then it is up to me and my job to explain to the patient what is achievable realistically in terms of a final result, what the limitations are according to the anatomy, and how we get from A to B in terms of what we're starting off with and the final result. I will always tell patients that their final result depends on three factors: their starting anatomy, which we will spend time analyzing, my surgical execution, and the patient's healing. If the patient's healing is suboptimal, then it could affect the result. And that's why it's super important that patients return for their follow-up. And I will see patients probably 2 or 3 times in the first 6 weeks to make sure that they're healing in the right direction. And if there's anything that I'm worried about, we will implement action to try to get the healing as optimal as possible.